Lesson 5.3 is on what is cancer and how is it caused. We have 5 objectives for this lesson, and we will be answering these at the end of the lesson instead of having a different set of questions. So make sure you leave some space so that you can write them, or you can write them on Google Docs. So you'll be able to explain the relationship between cancer and cell division, describe factors that contribute to the development of cancer, identify symptoms. So we're going to look at symptoms in abbreviation format, explain why cancers are difficult to treat, and we'll also see some treatment options, and identify ways to lower the risks of getting cancer. First, we need to understand what cancer is and different types of cancer that you can find. Cancer can actually develop anywhere in your body except for 3 places. The first one is hair. The other parts are nails and teeth. These parts are not necessarily alive, and that's why you don't have cancer growing on these parts. Depending on the types of cancer and its location, you have different names for it. For example, lymphomas are formed in your immune system. That means think of lymph nodes. They're going to be the easiest indication if you are having problems with your immune system and may have cancer or different types of illnesses. So lymphomas are for your immune system. Leukemias are for your blood forming organs. So a lot of times when you hear people or little kids having leukemia, they're going to have problems with their blood forming organs. For sarcomas, you have cancer developing on your connective tissues and bones. So anywhere in your body where you have connective tissues and bones, you can actually develop sarcomas. Melanomas is another one where you can develop either on your skin, eye, or inside of your intestine, or actually any cells that include melanin, which is basically a color pigment of either dark brown or black that helps you to have color. So on your skin, hair, or your eyes, iris, different places. Now, even though melanomas can form on different parts where that would include melanin, hair, like I said, would be an exception. When we have cancer in different body parts other than the ones that we looked into, they're called carcinomas in general, in other organs or skin or lungs. The following few slides, I have pictures of different cancer. I may have different symptoms like this page or how they look like. So you don't have to draw these, but if you want to add onto your notes next to the parts that we just went over, you can do that. So for lymphomas, I have a number of different symptoms that may help identify if you have lymphomas or not. Although I would not recommend you to self-diagnose because we're not doctors. I'll start from the top and then go to the bottom. So if you are feeling tired chronically, so chronic fatigue, you're going to have low energy oftentimes. Lymph nodes is another one that is very commonly used to identify if you have any health problems, not just cancer. So if it's swelling, you have a high chance of something's wrong with your immune system. Sometimes you may have shortness of breath for lungs. You may have liver and spleen swelling. It may just have different stomach ache or pain. You may have tiny red spots appearing on your skin that are not freckles. You may also have muscle aches or joint pain or tenderness. I would say the most important part is going to be the swelling of your lymph nodes. So make sure you add this one at least to your notes. Leukemia is also related to blood, like we said, or blood producing organs. So we have on the left our normal blood sample. So we see a lot of these reds, and these are all red blood cells. And then you have a little bit of these white blood cells, which help you to keep your body healthy and fight with different pathogens. Now, when you have leukemia, as you can see, you're not going to have a lot of red blood cells, and then you have abnormally large amount of white blood cells. And a lot of the times, these white blood cells are not going to be complete, or sometimes they're immature or abnormal. And because they suppress the production of white blood cells, you're going to have different symptoms like anemia and so forth. Even if our white blood cells are important to help our bodies fight with other pathogens, if you have too much of it, it's not going to be helpful because obviously you don't have enough other necessary parts of your blood to keep you healthy. Sarcomas form on your soft tissues and bones. And if you see the picture on the right, you'll see that these sarcoma is forming right next to your bone on your soft tissue. Muscle, tendons, ligaments, cartilage, anything can be the victim of sarcomas. Actually, recently I heard a case where this person developed sarcomas on a person's face, and it actually started eating away his gums, and he had this huge exposure inside of his mouth, and basically he had no idea until he went into the hospital and got checked, and it turned out to be sarcoma. So it can form anywhere where you have soft tissues and muscles. Here we have some examples of melanomas, and on the left side you'll see something darker than the person's eye color. And this is different from having different eye color originally. This is going to be forming after the fact that you are just living your normal life and you know that's not your normal eye color, and all of a sudden you start having these darker parts that form inside of your eyes. And also we have some skin melanomas that you'll see. On the left you see the benign one, and then the right one you see the malignant one. We are going to take a look at those words afterwards, but the ones on the right side are going to be the ones with cancerous cells, and you'll see A, B, C, D for that matter. If you have forms that are asymmetry, you have different type of regulated border, the colors are going to be 2 or more shades, and the diameter is going to be larger than 1/4 of an inch. So the ABCD of this part for melanomas would be helpful to know: asymmetry, having different borders, color, and diameter, so you can treat it if you have one. Now the question arises, how do tumors form? We do have different types of tumor, and we'll look into it in the next slide, but how do they form? First, we'll have to know how cells are going to reproduce. So first, genes would produce enzymes that would control the cell cycle. So these enzymes are basically different types of signals that would tell the cells to go on to the next phase of the cell division. Now, when we have problem in this enzyme production, the cell division can happen too fast or too quickly. Let's think about it. When you're trying to make something in a mass production in a short period of time, the quality of your product is not going to be as good as were to taking your time to produce something. For example, you're trying to write Christmas cards to your friends, and let's say normally it would take about 5 minutes for you to write the card. Let's say you gave yourself enough time, you started December first week, and you're able to finish all the cards on time with great quality. But let's think about someone who is rushing through the last week before Christmas and trying to write 35 cards all at once. You're not going to take much time. You're going to have reduced quality of cards, and it's not going to be as great. And sometimes you may have typos, you may misspell some things or someone's name or maybe even address. So in the same manner, if a cell growth is too rapid, you're going to have cells that are going to be faulty. It's not going to be wholesome, and they're going to start piling up in lumps. So this picture perfectly describes how the cancer cells are going to be. The top one is going to be how it should be, well-defined cells, and then the bottom ones are going to be uncontrolled cell division. As you can see, some are going to be bigger, some are going to be smaller, and they're not going to be how it should be. And the damaged cells are also going to be there, and they're going to become cancerous cells. The reason why you see a lot of damaged cells is because they do not rest. Normal cells, while you're resting, they're going to be resting as well, so they can repair any damaged parts. Now, if you're not taking that break, you're not going to be able to repair the damages. So even though you have these damages, you're going to just duplicate and produce more cells, and as a result, you're going to have more damaged cells and they can turn into cancerous cells. You may have heard of different terms of tumor. We have benign tumor, which is from Latin word benignus. It basically translates into kindly, friendly, or generous. We call benign tumor benign not because it's really, really kind, but it's because it's not cancerous. And also it grows slowly or slower than the cancerous cells. The picture on the bottom describes benign tumor accurately. It's surrounded by membranes. So if you see the picture here, it's going to have a pouch or a membrane or capsule to sustain the tumor, so it's not going to spread, so it prevents spreading. And really, it's so good to have it contained because it's easier to remove it. If you have it spread all across your body, it's harder to remove and get rid of it. Now, malignant tumor is going to be different. If you can look at the word here, malignant or malicious, we have the same prefix. It's going to be cancerous and it's going to grow faster. If you look at the picture on the previous page, it has the picture of malignant tumor. It's not going to be enclosed in a membrane. That means it's not going to be contained, so it can be carried to nearby organs and tissues. That means it's going to spread across different organs. When cancerous tumors spread into different part of the body, it's called metastasis. And it is dangerous mainly because it can affect other organs and also block the blood flow, and it's also harder to remove them with surgical methods. Whenever a person has a tumor, in order to find out if it's malignant or benign, they'll have to have a biopsy, which is basically testing a small sample of cells to see if they're cancerous or not. The second topic talks about the causes of cancer. So we'll look into several different causes of cancer. Sometimes it can be one thing, sometimes it could be several different things combined. So we can't always say that the cause of cancer is a specific thing, but we can say some type of cancers are going to be more because of certain lifestyle or certain reasons. The first one is a genetic cause. Some individuals may have oncogenes, which are basically cancer-causing genes. And for example, we have breast cancer and ovarian cancer that are highly depending on that genes. So for example, if you know that your family members would have a history of having breast cancer, then you have a higher chance of getting the breast cancer. Next one is tobacco use. We are going to look into tobacco and alcohol in a separate chapter later on, but using tobacco can cause different types of cancer, and it can be used for any type of tobaccos. So cigar, cigarette, light version, electronic version, they are all going to include harmful chemicals that can affect your body. It causes about 85% of lung cancer, and when you have these carcinogens from tobacco, it can go into different bloodstreams and other organs and can affect your body in a negative way. Continuing from tobacco, it is also the major cause of 440,000 premature death. That means babies with a mom who smokes, they're not going to make it and they die before they are born. Every year, about 3,400 non-smokers from secondhand smoking dies with lung cancer death. So even though they're not smoking, actually, they can die because their family members are smoking inside of their houses. Having a family member who smokes increases the chance of developing lung cancer for the non-smokers by 20 to 30%. Also, diet and physical activity can affect a person to have cancer or have a higher chance of getting a cancer. For example, poor eating habits like skipping meals, imbalanced meals, eating a lot of fast food can also contribute to having a higher risk. Also, lack of physical activity or drinking alcohol and using different types of drugs. Interestingly, 1/3 of all cancer is linked directly to unhealthful lifestyle. So really, other than having the genetic components, how you live and how you choose to live can affect you greatly. The main reason is probably because if you are having unhealthful lifestyle, it can lead to producing too much hormones for rapid cancer growth. So obviously, if you have too much growth, a lot of times it can turn into malignant tumor. Another reason can be a viral infection. You may have viruses that enter into your DNA or RNA, basically different types of your genetic code, and about 15% of all cancers, for example, human papilloma virus can infect people, especially women, to have cervical cancer later on. Because it's not from your actual cell division and how cells are growing rapidly, it is going to have relatively slow cancer growth rate.